Welcome, Dr. Sharma. Today is May 8th, 2020. And once again, it is a blessing to have another session of mental health with the famous Dr. Dave Sharma. Welcome, Doc.
Good to be back with you, Dr. Vasconcelos, the famous Dr. Vasconcelos.
Doc, today, as we are dealing with this COVID-19, COVID-19 coronavirus, the latest stats are we have 3.8 million cases worldwide and over 271,000 people dead. Just here in the US, we have 1.29 million people and over 76,000 people dead. And so it's a very difficult times we are in. And today, as we look at mental health, I would like you today to address on substance abuse, and even alcoholism. Today, in today's context, alcoholism, drug abuse has been around for a very long time. But now that we are in the middle of a pandemic, obviously, it's a even worse situation for many individuals, families, communities. And so I would like you to, first of all, tell us a little bit about alcoholism and drug abuse, and then we can look at the consequences of this problem.
Thank you, and good to be back with you. You're getting some good feedback on this program, so I'm really happy that we're reaching people. The problem of drug abuse has been there throughout the ages, and it's been a problem in all societies. So, even when it's being banned and people are not supposed to use it, there's illegal use, which makes it even more dangerous. We saw in Iran that persons had developed methanol toxicity, and I think they were doing those, drinking the methanol sort of self-purification, and in actual fact, methanol and or the illicit liquor that people make from wood and so on can really produce a lot of methanol, which is very toxic to the optic nerve, but people get blind, and there were a number of cases of blindness. So even in countries where alcohol is prohibited, people will find a way to make it. So it's there in all societies, and it is a major problem when it becomes an abuse. So we do know that people use it socially. The question is what makes it an abusive situation is often difficult to recognize, because the individuals who suffer with problems related to alcohol, including alcohol dependency syndromes and withdrawals and associated medical complications, have a defense that they use called denial. So it's very hard for them to accept that there is a problem when they're using this mechanism called denial. So to overcome denial comes an understanding by family members and those who care for that individual that this condition that people are affected by is not a mental weakness or a weakness of an individual's mind or brain. Many of these persons who abuse substances actually have excellent brains or really come from very good professional backgrounds, and they're intelligent. So one would say, why would they not recognize that they're doing this thing and it's affecting others? But when it affects others, it means it become a problem. It's clearly not making the person feel good. It is making them feel irritable and moody, and they're behaving in a difficult manner with their families, and that's why they get on their case and they want to try to get them to stop. But if the families must also understand that we consider this problem as a disease process. So it takes over the brain, it starts to change the way the person functions and their mental cognitive abilities. Their memory gets affected, it starts to damage the body. And it damages almost every single organ system in the body, including the heart, the liver, the kidneys. Sexual function goes down. So there's a wide range of problems. The pancreas can go really bad. So how can we help those persons overcome that denial? That's a critical question. The person doesn't accept that they have a problem. Berating them, chastising them is usually not very helpful. It makes the person feel bad. When an individual feels bad, they probably turn more to the habit than less, So there are ways to recognize it that the individual is gone out of control. A simple four questionnaire that Ewing devised helps. It's called the cage questionnaire. And if the person fails two of these questions, it's likely that they have a substance problem. We usually use it for drinking, but it can be applied to other drugs like cocaine and marijuana and so on. And it's CAGE, cage, the cage questions. And the C is, have you ever tried to cut back your drinking and failed? So many a times the individual wants to stop, or they may say, I'm going to drink just a couple of drinks, and then they go on and they lose count. Because after about four drinks, people don't know how many they drank. So if you ask somebody who's drank 10 drinks, and say, how many you drank? They'll say four. If you ask them if they drank like 12, you say, how many drinks did you have? You say, I think about four. So C is an inability to cut back. A is getting angry when people talk to them about their drinking. So you're drinking too much and said, well, I don't drink too much. I see you drinking just as much. So they get back. It becomes a confrontation. G is a person feels remorseful. They feel guilty about the actions they do, the violence that they may, you know, perpetrate on others when they become intoxicated, and they often feel remorseful and they try to make up with good behaviors or stopping for some days, but they often return back to the drinking. And the E question, which is called the cage E question, is most significant. If somebody has to drink as an eye opener, just to function, it's usually a sign that they become very dependent. And if they don't drink early in the morning to get going, they are going to get withdrawal. And the withdrawal usually comes with pretty bad shakes. So that's a problem with these addictive substances that people need to use more. They develop a tolerance. So they have to take more and more and more to get the same effect. And it's all across the board, whether it's marijuana or the opiates are very famous for tolerance, and alcohol. So people can go on to drink a huge amount. And while they may feel proud that they can actually drink so much alcohol as compared to their friends, it is a sign that their liver is overacting now, trying to detoxify, and they're becoming dependent physiologically on their drinking. The problem we see now with the COVID crisis is that persons are bored. Boredom is one of the big factors for people drinking. You'd want to ask, why would somebody so intelligent, a professional, a doctor, a lawyer, much less persons who are, maybe at not that advanced educational level, why would they use alcohol? And many a time it's because they're bored. They also use it because they're frustrated. It does help to calm people down. They use it for anxiety feelings. They use it to feel better in themselves if they're depressed. More women tend to use alcohol because of depression, whereas men tend to use it because of the frustrations and irritability feelings, that it helps to calm them down, it helps to reduce the stress of their lives. So the problem with using is all across the board. And it doesn't have anything to do with the intelligence of the person. It's just that it becomes a habit. And the habit becomes a dependence. It becomes a physical dependence by the brain needing that substance, looking for that comfort on a daily basis. So the person is now physically and psychologically dependent on the drug. So that's a way people turn to these drugs in this time of COVID, where the boredom is high, people are at home, they've got a lot of frustrations, a lot of worries, a lot of stress. Alcohol is a quick fix. It really solves a lot of these problems. By taking away the memories of loss, it can help people when they're in grief, they can overcome sad feelings by turning to this drink. So we got to know that we're dealing with an enemy that appears to be a friend, and it's very deceitful. It pretends to be a friend, but it actually turns against the individual and destroys them. It takes control over them. So if you're thinking in a spiritual way, it's almost like a demon in a bottle. And sadly, it is a hard thing to convince people that they drink too much. But if a person's open their mind to the fact that they are positive for more than two of those cage questions, Mark, I think they will see to themselves that there is a problem. One of the techniques we use medically is to get the person to do a good medical history with us, and then we could show them how it's affecting their personal life, their physical life, their occupational life, their social life. Most marriages fail because of alcohol, that if it's a problem, it really disturbs and dysfunctions the whole family. And there's significant regret, or there's often so much damage, it's hard to fix it. But we use that evidence in the medical history along with laboratory evidence. So if we find that the liver is damaged, I just had a young man today where his liver is being damaged. He's just 22. The amount he's been drinking is enormous. He's a farmer, a very bright young man, and he's got signs of liver damage. His ultrasound is showing fatty infiltration to the liver. So it is a major problem. I'm not talking only about alcohol. All addictive substances will damage the body. The cocaine will damage people's heart and brain. Marijuana, was we consider it more of a softer drug in terms of not creating so much violence, it does damage the memory centers. So all addictive substances have very negative effects on the body. Nicotine, which is legal, it does cause significant lung damage and chronic obstructive pulmonary disease. So, Mark, today it's a chance for us to let our people be educated to the fact that boredom, we understand, can make people turn to drinking. They're at home, they're spending the day, not doing much, maybe watching TV. It's easy to grab a drink, and you never know how many go down over the daytime, but it will damage the brain eventually. And the need to stop is to find alternatives. So whilst we may condemn and say, okay, stop your drinking, you got to look to finding alternatives or fixing the underlying problem that's causing this
That's excellent, Doc. It is so true. In terms of finding an alternative, especially when there's a denial mechanism within an individual, can be challenging. And so, would be some steps to let people know there is an alternative, and this is what you should consider? Because the fact is, there are a lot of statistics, and you touched on a lot. For example, the cage questions, it would require for you to see them. So a lot of people, they
problem.
refuse to want to seek treatment. A lot of people, because of the denial mechanism, they feel it's not a problem. The statistics show that many times it starts as a teenager. Many individuals begin at the teenage years with experimenting and eventually abusing alcohol and drugs. And so there's no question the effects it has on the economy, on productivity. As you know, a lot of people, I deal a lot with prisoners, and a lot of them would wake up in jail and they not realize the crime they
Mm.
committed. So significant amount of crimes are committed under the influence of alcohol. And in spite of all these facts that we know, we still see, especially in a country like Guyana, where suicide rate is high. One of the things, as like yourself, we try so much to educate people in the context that may not be able to go to university or a seminary or receive any kind of formal training or education. But in attempt to help people, it is so important the educational aspects. I always say in societies, you can have an idea of the quality of society by the amount of libraries they have. And
Mm.
so
Mm.
if in trying to help someone who may be grew up in a home where a parent was abusive for alcohol, and to them it's normal. To some people, they take pride rather than having a nice library in their home, to have a nice bar in their home. So the question
Mm.
is, at what point would you say that someone needs to understand there is treatment and this is the step you need to take? What would that be?
So there's a point of overcoming denial. So if the individual can open their mind to the fact that, look, I do have a problem. My family are not just on my case. I have a young man who is still in denial, and his family, very educated, very bright person, and yet he still would not accept himself, despite all the behaviors he sees that happens when he's drinking or when he's intoxicated. It's not good. So it sometimes takes a crisis for a person to understand that I do have a problem, and we're hoping that that doesn't happen. That there shouldn't be a crisis in the marriage or the relationships. There shouldn't be loss. There shouldn't be death. I know of a famous person who struck down a young man when he was drunk, and he has to live in grief now. I think a famous baseball player, and he's got to have that in his conscience that while he's intoxicated he was driving and caused somebody to die. So these are the very dreadful things that can happen when people abuse drugs. So I think if somebody can open their mind to just those four little questions that you devised and recognize that they have one or two of those things that are positive, and it's a sign that there is a problem in their use of these drugs, they can start to think about ways to get help and reaching out to persons of expertise, medical persons, counselors. These are the people out there. There are hotlines all about for people who are very depressed, suicidal, that can help.
Well, Doc, one last thing is we have an issue right now with not illegal drugs or alcohol per se, but prescription drugs, painkillers specifically, where there's a lot of people, especially in the context here in the US, that are dealing with this. Someone who may not realize the the avenue they're going down, because a lot of them, in order to uh, maybe their medical doctor does not prescribe or refill the medication, they tend to want to find alternatives and then go, and the consequences are very serious. What would be your recommendation to someone before they get to that stage to say, listen, if your doctor prescribe you medication and it's not normal for you to go and do something else and lie to that doctor, and then suddenly you wake up dead because of an overdose, what would be your recommendation to someone who might have done it the right way, went got painkillers, but now
Mhm.
does not realize a kind of a same denial mechanism?
Yeah, no, that's a very good point. The problem of prescription overuse is very high, and persons will use all kind of strategies to get a refill of drugs that create dependency. So it's got to be a two-way street that the physician is aware and monitors his patients. For example, if somebody comes and asks for a refill very early and they're making excuses that they lost the prescription and so on, you start to get suspicious. If you lose that patient, you can start to track what happened to them because they've gone looking drug seeking elsewhere. And we feel for patients who need medications because they may have a problem that requires treatment, but they're abusing opiates that they were prescribed for pain. We got to find ways that treatments that will not cause them harm or lead to self harm. So that having a very healthy relationship with a physician, self awareness is very critical for all our people. That we let go of some of these defenses that we have in our brain. And maybe we should do a program on defenses because the human brain creates these cover ups. We don't want to look bad in the eyes of others. Our families know us for who we are. We may pretend to everybody out there, but they know the truth, and they know who you are. So we gotta respect when they talk to us. So we got to look to being the best person that we can be. I think everybody wants to be the best they can be. It's an easy fix to turn to a drug for comfort, to ease the pain. It's much harder to go through therapy and making that effort, but the end result is much more rewarding. We become a better person, we become stronger, we make sense of the life that we're in. And when a young person is caught up with drug, a very brilliant young lady who's a challenge, she's very questioning. I could see she has no purpose in life, and she told me, "Oh, I don't have. Give me some meaning to life. I don't understand why I'm living. I see no meaning to my life." Um, I said, "Well, there's a meaning to life. You weren't put here on this earth for nothing. Look at the academic ability you have. Look at the brilliance you have in you, in that brain, and you're questioning something that you give in a gift. You got to use your gift, and you will see as you grow, you'll understand things better." So, that's the way we got to help people, that we all have a blessing, and the blessing is this life that we've got. We've got a brain. We got to make the best of it. I feel good about what the life is all about. We're lucky, me and you and everybody who is able to listen into this program. We are lucky because we are alive, and nobody wants to die. We all want to be alive forever and ever. Yet it's a short journey, and we gotta care for each other. The purpose of life, as I see it personally, is the ability to give that care and to understand that materialism is enjoyable, but it's not the purpose in life. It is that being able to reach out to others, to support, to care, and share. These crises that we have in this COVID crisis is a time for us to reflect on that. And I think if we do that, turn away from abusive behaviors, addictive behaviors, aggressive behaviors. These are not part of what humanity should be about. Humanity is not about aggression. That is a lower instinct. We have it in our brains, Mark. We actually have that primitive brain, but the primitive brain is almost like a reptilian brain. It is savage, and a human being that's advance is not a savage. We gotta find that greater purpose in ourselves. Let go of these things, these habits. Get help. There's medical help out there for everybody. A lot of support that is available. Spiritual help is powerful, and I'm hoping that you can do one of the programs talking about the power of spirituality for helping our people.
Absolutely, Doc. Absolutely. Well, we are so grateful to have you once again, Doc, and you are a blessing. And I'm confident everyone listening to this program will enjoy it. And we're thankful that you have taken the time every week for us to do a session on mental health. And we want to remind people that there is help. And so, thank you so much, Doc. God bless you. You stay safe, and we look forward to another session.
Thank you.